What is the difference between ice and heat? When should you use ice and when should you use heat? Both are great at helping with pain, but they work differently. Ice helps calm down inflammation and heat. So if your joint is hot, swollen, and painful, maybe from a new injury or an aggravated injury, ice can help that. Heat brings blood flow to the area to help warm something up. So something that feels tight and stiff, heat can help with. I recommend people use ice if they have a new injury. You bump your arm, you fall down, you're sore and achy from the fall, use ice. If you wake up in the morning with no new injury, but you're tight and stiff and achy, heat can help. Heat will bring blood flow to the area and help calm down any tight or stiff joints or muscles. Heat also helps calm down tight muscles that are from a muscle spasm. So if you have a neck ache or a back ache from an injury that happened over a week ago, but it's still aggravating you, now you can use heat. It brings blood flow to the area to help calm down any spasming muscles. Now, how long should you use these for? I recommend at least 20 minutes at a time. Really, you only need 10 minutes, and more than 30 minutes doesn't give you any extra benefit. So I split the difference and I say 20 minutes. And for however long you have it on, that's the amount of time you need to have it off before you put it on again. So for example, if you are using ice or heat for 20 minutes at a time, take it off for 20 minutes before you put it on again. Now, what if you've used ice or heat for a while, 2 weeks, 3 weeks, 4 weeks, longer than that, and it stopped working? You don't have a new injury, but using just ice doesn't really help. Using just heat doesn't really help. Use them both. I recommend doing heat followed by ice because then you can warm up the joint and then the ice stops that blood flow activity to keep it there to help continue the healing process. And if you use ice first, you could numb up the area and then the heat goes on. If it's too hot, you can't tell that it's too hot. So that can be dangerous. So heat first for 20 minutes, immediately followed by ice for 20 minutes, and then leave them off for 40 minutes before you put it on again. Typically, you can use ice or heat or the combination as often as you want during the day or night. Just leave it off for however long you had it on. Whenever you have a new injury, use ice for 20 minutes at a time, frequently throughout the day. So at least 5 times a day for the first 7 days. That's when you have a new injury. You've bumped your arm, you've fallen down, you have some swelling, or you've had a recent surgery. When you use heat, it's usually not from a new injury. So use it for 20 minutes at a time, as often as you want. Usually, in order to see an effect, you need to use it more than once a day, but you get to decide how many times in the day. Try 3 times in the day when you're using heat for the first time.